Hello, it's Dr. Gary Burton coming to you from beautiful sunny Florida, and today we're going to talk about postoperative care or tips following blepharoplasty surgery. Blepharoplasty is an eyelid lift procedure. It can be done over the upper eyelid or the lower eyelid, or it can be done as a combination upper and lower eyelid procedure at the same time. This procedure can be done under general anesthesia, or it can be done under local anesthesia with oral sedation. The key thing to recovering from this operation is your preoperative care. If you're taking any blood thinners, including Advil, Motrin, vitamin E, garlic tablets, you need to discontinue these medications prior to the operation. Also, I want you to discontinue any diet pills, including Ozempic, prior to the operation. I need you to discontinue these medications at least 2 weeks prior to the operation. If you have high blood pressure, I need you to monitor your blood pressure before the operation to make sure it's under good control. So follow your primary care doctor recommendations if you take medication to make sure your blood pressure is under good control prior to the operation. And if you're a smoker, stop smoking at least 1 month prior to the operation and be prepared to not smoke for at least another month after the operation. In a recovery room, you will wake with a cold compress on your face, and when you go home, I'm going to ask that you continue to apply either a cold compress or an ice pack to your face. I like for my patients to apply an ice pack to their face for 15 minutes on, 15 minutes off for the first 48 to 72 hours after the operation. After 72 hours, you don't need to apply ice to your face anymore. Other products you can use to help with bruising and swelling, one is Arnica Montana. I find this helpful for facial cosmetic surgery, not so much for larger procedures of the body, including liposuction, abdominoplasties, and BBL type procedures. But for facial cosmetics, I find it to be fairly helpful, and it can be used to help with bruising and swelling. The best thing for postoperative pain following a blepharoplasty surgery is to get ahead of the pain. I like for my patients to take extra strength Tylenol several hours before the operation and then continue extra strength Tylenol as needed for postoperative pain management. So for my patients undergoing elective facial surgery, I send them home with 3 medications: a prescription pain medication, something for nausea and vomiting, and an oral antibiotic. Of the 3 medications, the only one I'm going to ask you to take is the oral antibiotic. And for postoperative pain management, start off with extra strength Tylenol. If that gives you good pain relief, that's all you're going to need to do. But the prescription pain medication is there for you if you need it. I encourage all my patients to get up and walk around as soon as they can after the operation to help promote the circulation in their legs, but no strenuous activity. No strenuous activity for the first 2 to 4 weeks after the operation. After that, you may resume full regular activity. And if you're out and about here in sunny Florida, I recommend that you wear sunglasses for the first month following the operation to minimize direct sunlight on the surgical incisions. For the lower eyelid, I repaired the incision with an absorbable suture, and for the upper eyelid, I repaired the eyelid with a permanent suture. I will see you back on postoperative day number 4 and day number 7. On day number 4, if the absorbable suture of the lower eyelid is still present, I'm going to clip these sutures away. And I'm going to see you back on day number 7. On day number 7, I'm going to remove the permanent suture that I placed to repair the upper eyelid. This is Dr. Gary Burton. I hope you enjoyed our little tip video on blepharoplasty postoperative care. If you have any questions or concerns, leave it in the comments section below. See you on the next video.